Hey, what's up, everybody? This is Dr. Andrew Kim M.D. I'm a board certified psychiatrist, and today's video is about POCD, Pedophilia-themed Obsessive Compulsive Disorder. This is a variation or a subtype of OCD that carries a lot of taboo, stigma, shame, oftentimes then becoming a barrier in itself to want to seek professional help to recover from this type of OCD. So, as a disclaimer, again, this is not going to be a video going down a rabbit hole about pedophilia or about pedophilic disorders. We're simply going to define and distinguish the difference between POCD and the latter two that I just mentioned. But if this is a topic, even by going through definitions and defining a variation of OCD is going to be triggering or too emotionally charged, please, this is your disclaimer to pause, hop off this video. You can feel free to skip. But for those of you who are interested, and I'm assuming you've gotten this far in the video because you have concerns yourself that either you or a loved one may be suffering from this, and it's challenging sometimes to take that first step to seek help. So today we're going to go through definitions to help people, whether it's you or your loved one, understand what this variation of OCD is, how this is different than pedophilia or pedophilic disorders. And we're also going to talk about common themes of obsessions and common compulsions that one may go through. Okay, so let's start with definitions. Okay, as we said, POCD is a variation of OCD, obsessive compulsive disorder. And OCD means that one has obsessions, which are recurring intrusive thoughts, images, urges, or feelings that cause fear and distress. Then there are the compulsions, which are repetitive behaviors, and those behaviors can be internal mental behaviors or overt actions that are performed to get rid of the distress caused by the obsessions or to prevent something you fear from happening. Okay? This is different. This is not the same thing as pedophilia or pedophilic disorders. The distinguishing feature of POCD to distinguish this from those two is that there is an absence. There is an absence of sexual arousal to children. This is about obsessions and compulsions. This is not about having actual sexual arousal towards children. So let's very briefly define pedophilia, which is a subtype of paraphilia, and then also pedophilic disorders very quickly. I'm just going to read this for the sake of speed, okay? Pedophilia is defined as recurrent and intense sexually arousing fantasies, sexual urges, or behaviors involving sexual activity with a prepubescent child or children, generally aged 13 years or younger, over a period of at least 6 months. The definition of a pedophilic disorder is that you meet the criteria for pedophilia that I just read off, but the individual also must either act on their sexual urges, an actual action, or experience significant distress or interpersonal difficulty as a result of their urges or fantasies. Okay? That individual must also be at least age 16 and at least 5 years older than the child that we're referring to. Okay? So let's go back. Now that we've said this POCD is distinct from pedophilia, it's distinct and different than pedophilic disorder. Let's talk about more of the nitty gritty of what are the common obsessional themes and common compulsions within POCD. Okay. When it comes to the obsessions, I kind of categorize it as obsessional themes tend to latch onto past, present, future, and moral based themes. For example, POCD can latch onto things from the past. I used to play pretend doctor with my friend from next door. Was that the start of me having pedophilia? Were there some sexual undertones to the play that we were doing? When I was 11 years old, I kissed that 10-year-old. That must mean I'm attracted to 10-year-olds, right? There's almost kind of a fallacy in logic, yet this kind of misconnections of connecting the dots the wrong way can happen. I was 11. I kissed a 10-year-old that I had a crush on. That must mean I'm attracted to 10-year-olds now as an adult, right? Did I sexually harm a child and block it out of my memory? So I don't remember ever doing anything, but maybe I blocked it out of my memory. There's a gap in my memory. Now I need to go ask everyone I know if they ever recollect me harming a child, right? This is how obsessions of POCD can latch onto the past. Now, POCD obsessions can latch onto things happening in the present. I see a kid walking on the sidewalk towards me. If I don't move away, that might mean I'm attracted to them. Hey, did I just have a physical sensation after looking at that child? Becoming hyper attuned to every twinge in your body, every sensation in your body, misinterpreting signals. These are things that can happen in the present. And there's also future oriented thoughts and themes that obsessions will latch onto. Well, I'm never going to be able to have children because I'm having these kind of thoughts. If I'm not even though I have evidence that I'm not that I don't have pedophilia, I have no evidence after all this research. I could become one in the future. It's always a possibility. And that right there, I'm going to pause and say this is kind of the trap of OCD in general and POCD included. The trap is if I can gather more evidence that I don't have a history of pedophilic disorder, then this will simply go away, right? It's this fallacy that I can convince myself and convince this away. But there just seems to never, ever be enough evidence because, again, going back to the concept of past and future, even if you compile evidence, you can say, well, I could have forgotten something I did. I'm just not remembering it. Or it's possible I could do something someday. Even if you have zero evidence that you've compiled, you'd say, well, I could still possibly do something at one point. Past, present, future. And then I also include those moral struggles. Does God hate me for having these sexual thoughts? What will my spouse think? They'll leave me. They should leave me. I'm a horrible human. I'm a monster, right? So these obsessions are rampant. They are time consuming. They are energy sucking, and they're very disruptive. Now, what are some common POCD compulsions, right? People might get confused, right? Because they hear the word compulsions and they're like, well, are you compulsively acting on these things? Well, wouldn't that be pedophilic disorder? No, here's the difference, right? The compulsions of POCD can comprise of the following: overly being reassurance seeking from others. Hey, I just talked to that woman over there. She looked above 18, right? She looked above 18 to you, right? Or did they look like a kid? But you got to tell me real quickly. She was definitely over 18, right? Right? Reassurance seeking, right? Reassurance seeking about the past. Hey, remember that one time when I was younger and I did this thing with that friend of ours and I didn't do anything weird, right? I didn't cross any lines, right? You got to tell me that, right? So reassurance seeking about the present, the past, reviewing and over scrutinizing your past actions for evidence for or against pedophilic behaviors, spending a lot of time researching, watching documentaries, reading articles, reading about cases, sometimes in secret, right? In order to compare and contrast yourself of how you stack up and how you compare and contrast to people who have been convicted related to pedophilic behaviors, pedophilic related crimes, right? Turning down job opportunities that involve working with children, compulsively avoiding situations where you might have to interact with children, maybe even your own children in your own household, choosing to not have children in your relationship. Sometimes even committing illegal acts of watching child porn to check if your obsessions are true or not, almost testing it, which I would definitely not recommend you try to do, okay? So these are the things that can happen as compulsions related to POCD, okay? And amidst that, right, you can see how time-consuming, energy-consuming, disruptive, not only the obsessions, but the compulsions, but definitely the combination can be for those with POCD, okay? Now, I'll be brief here because we've talked about it in other videos about OCD in general, but the staple therapy when one is motivated and at the stage where they're willing to seek help and able to seek help, best primary intervention in my opinion, based off evidence as well, is therapy, therapy, therapy. Okay? I'm not dogmatic saying there's only one way, but I would say in general there is the most evidence for the most robust results through cognitive behavioral therapy or exposure response prevention therapy, so CBT or ERP. Okay? These are really going to focus on identifying your distorted thinking, helping you better understand the subtypes of distortions that are occurring, and then helping you gain insight into how your thoughts, actions, and behaviors are all intertwined and working on behavioral modification. For example, you see some child walking down the street towards you, and part of your CBT or exposure exercises for ERP might be working through the discomfort, the tension, the anxiety, the doubts, all the different thoughts, the physical tension that's building to continue to walk and walk past that child versus what you used to do, run across the street immediately to avoid that interaction, right? And then discussing in a therapy session how that exercise went, working through what went well, what didn't, and coming up with new strategies and how to approach that, right? I mean, that's just kind of a snippet of an exposure exercise one may do to help modify behavior, gain more insight into cognition. So that's not going to do it justice, but that's, we could talk a whole hour just on that alone, but that's kind of what you do in CBT or ERP therapy. Okay. Now, again, to be very clear, that is the primary intervention that is recommended. Now, do medications play a potential role in treating POCD? I'd say yes, because medications play a role in treating OCD in general, regardless of the variation or subtype of the content of OCD. So when it comes to medicinal treatment, the medicinal category that is recommended is it's SSRIs, selective serotonin reuptake inhibitors. Now, there is this misconception because SSRIs are known in society as antidepressants, but they are also typically used in OCD itself to supplement and complement therapy. Now, to back up, I would say, look, when it comes to evidence base, I would say the evidence is superior in terms of long-term outcomes with ERP or CBT therapy compared to meds alone. Okay. So again, I did not say the words the medications are a necessity or that they're better. I'm just saying if one wanted to supplement or complement the appropriate evidence-based therapies for OCD, then SSRIs would be the first place to start in order to do that. In a pinch, could SSRIs help OCD without therapy? They could help, but I don't think that's ideal. I really think it should really be the mindset of I should do, at the very least, an acute course of ERP or CBT plus or minus meds, not the other way around, in my personal opinion. Okay. So again, in summary, POCD or pedophilia-themed OCD is a variation or subtype of OCD. It is distinct and different from pedophilia, pedophilic disorders, and bottom line, it is a very treatable condition. OCD is a very treatable condition, and it is worth putting in the effort to find the motivation to find a good therapist, because if not, there is the potential that OCD can really disrupt your life. OCD often wants to control and disrupt your life. It wants to influence how much time you have to devote to the obsessions and the compulsions, time and energy. It can influence and dictate who you decide to spend time with, who you need to avoid, where you can or can't go, decisions about relationships, whether you want to have children or not. It can disrupt your job and your academics, et cetera, et cetera, et cetera. I mean, it can affect all the various domains of your life if unchecked and untreated at times. Okay? It is very treatable. I know that the stigma and the shame about this particular spin and variation of OCD can make it challenging to want to seek help. But bottom line, if you've made it to this point in the video, that means you're either very interested in this topic, you are worried that this may apply to you, or you know someone that this may apply to. And that is the message I want to end with, is that this is a very treatable condition, and it is something that I recommend you seek help for, because there is hope. There is hope, and this is something that can get better. And this is something that can become less disruptive and distressing in your life. So I'm going to end on that positive note. If you found this content helpful or intriguing, please subscribe, please like, and follow along for other future evergreen content like this. Dr. Andrew Kim, signing off.